If you're in the Royal Marines and Royal Navy, your job can be physically demanding and fairly arduous at times. Roughly 20% of those serving are medically downgraded, and half of those are due to musculoskeletal injuries. So what are they?
Musculoskeletal injuries, any injury that affects the bones, muscles, ligaments, nerves or tendons resulting in pain, and this is referred to as musculoskeletal injury.
Being downgraded can stop you deploying, which is why the Royal Navy is teaming up with Bath, Southampton and Exeter Universities to try and look at types of prevention.
Once our people become injured, then organisationally, I think we deliver a really good expert service in terms of helping our people to recover and rehabilitate back to full fitness. So services provided by Defence Medical Services, a range of support from physiotherapists to exercise rehabilitation instructors to sports and exercise medicine consultants. So the support that our people receive once they're injured is really good. What we perhaps have been less good at over the years has been providing that assistance, that preventative medicine assistance to mitigate those risk factors that we know can increase somebody's risk of injury.
Which is what the service wants to rectify. So they are bringing in academics to look at certain aspects of body movement. Here comes the science part.
What we can do is use the tools of biomechanics, so methods that measure movement, so things such as how much your knee is bending, how much your ankle is rolling in. We can measure those with different motion capture systems. And then we can also measure external to the body, the forces. So we can use tools such as a force platform or a pressure platform. So a device is placed in the ground, and when we walk or run or jump on that surface, we're measuring the force.
In autumn, Commando Training Centre, Royal Marines, HMS Raleigh and Britannia Royal Naval College, all based in the southwest, will become homes to specialist laboratories to screen personnel.
We have this big advantage, or if that's the right word, with military populations, especially in training, that they all start at the same point within reason, and then they partake in the same training. Some of them get injured and some of them don't. So we would interpret from that there's something individual about those personnel that makes some of them more susceptible than injury than others. We focused on biomechanics. Other universities are focused using their expertise in their respective areas on other aspects. And so we're starting to get an understanding of factors that may be influential.
All three universities will combine data which will be collected over a number of years as part of what's being called the Royal Navy Musculoskeletal Mitigation Programme.
We do expect a lot of our people. We put them into situations, whether that's working in cramped compartments on ships and submarines, whether that's carrying heavy loads, if we think about our Royal Marines and moving across difficult terrain. So the job in itself comes with inherent risk. So we will not reduce the risk to zero. But what we're working towards is, can we reduce that to as low as practically possible?
This collaboration could provide new intervention methods that could dramatically reduce injury throughout the Royal Marines and Royal Navy. Bryony Williams, Forces News. If you enjoyed this video, don't forget to like and subscribe to our channel.